Hi, beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and today's video is to highlight National Minority Health Month. So, every April, the U.S. Department of Health and Human Services Office of Minority Health observes this month, the month of April, for National Minority Health Month. And the whole point of it is to improve the health of racial and ethnic minority and American Indian and Alaskan Native communities and reduce health disparities. The theme for this 2023 month of April is better health through better understanding. And I love that they are doing this by focusing on culturally and linguistically competent healthcare services, information, and resources. Now, if all of that was a mouthful, let me break it down for you, okay? Better health through better understanding and culturally and linguistically competent services, information, and resources. All that means is, I'm gonna bring it back. Communication is key. Everybody knows communication is key, or the phrase communication is key. However, communication does not mean understanding. Meaning, just because I communicate something to you, it doesn't mean that you and I have an understanding of what I just communicated to you. It doesn't mean that we're on the same page. And if you don't know, but I'm pretty sure you've experienced this, unless you live in somewhere where only your culture exists and you are only exposed to your culture. Unless you're not in that type of environment, you can understand what I'm about to say. There are differences in cultures, whether it be practices, or whether it be language even, okay? So I might say something to you that may be a known phrase in my culture, and let's just use English. I may say something to you normal in my culture, and you may interpret it a different way because it's not a phrase in your culture, or it doesn't mean anything in your culture in that way, and you interpret it in a different way. But when you're talking about healthcare, it is very important to be on the same page and have an understanding. You never want to be in a situation where you're the healthcare provider and you're communicating something to your patient, and while they may hear what you're saying, they may not necessarily understand what you're saying and what that means for their treatment plan. For instance, in terms of fasting, or in terms of travel, or in terms of things that are observed on certain days of the week, okay? Or things that people don't do during certain times of the day on certain days of the week. You have to factor this in as a healthcare provider when you're talking about certain treatments, certain treatment plans. And if your patient isn't on the same page as you, the treatment plan can fall through the cracks, and then that person's health can fall through the cracks, right? The whole point of better health through better understanding empowers these communities, because when they are able to access resources that are culturally and linguistically competent, they can empower themselves and their own communities to be able to have better health. And that's the whole point of Minority Health Month, okay? So I do want to give you a couple of facts, like, did you know? Did you know it is estimated that only 14% of the U.S. population has proficient health literacy? What that means, health literacy is when you are able to find, use, read, obtain, get information that you can then use to be able to help you to make healthcare decisions or certain actions, okay, that are related to your health that can improve your health. That is healthcare literacy or health proficiency in literacy. Health literacy, that is what it's called, being proficient in health literacy, okay? Knowing how to take in information and use that to actually make health related decisions, okay? Did you know nearly 20% of people in the US speak a language other than English at home? And this kind of targets on the whole, when you're saying about linguistically competent and all that. Literally, there are things that are lost in translation, okay? So that's where that comes in, better health through better understanding. Because you got to understand first before you can do and improve your health, okay? So that's why that is important. Did you know? It is estimated that over 60% of racial and ethnic minority patients over the age of 18 believe that it is at least important to visit a healthcare provider who shares or at least understands their culture. Now, I'm surprised this number isn't even higher than 60% because, like I just said, there are things that do not, it's not across the board when it comes to culture. It doesn't flow from this culture to that culture to that culture. Not all cultures are the same. We already know this. So it's just surprising to me that that number isn't higher, because if you as a healthcare provider are from that particular culture, you already know, so you have a wealth of information that other providers who are not in that culture has, because you know, from experience, you share something with the patient that other people who are not in the culture experience. And I'm blanking on an example right now that I can give, but the whole point is you can give them a perspective from as their doctor or healthcare provider, and as someone who is directly immersed into their culture, comes from their culture. So you can speak to them from, you know, both of those angles. And even then, you already have kind of a built-in trust there. And even if you are not in somebody's culture, it is important to at least understand and be able to, even if you can't relate to, be able to understand from that perspective and why some things may be an obstacle, or even why some things may be a little bit easier, just coming from where that person is coming from. And that's all the point of this is to shed light on these type of things, because a lot of the times, if you're not experiencing it, it's not happening to you, then it's not happening. And that is not the case. That is why it's important for these type of months, these type of observations, to bring light to the fact that there are disparities, but they can be reduced through these type of things, bringing awareness and bringing understanding, so that everyone can be on the same page, so that people can in turn have better health. So if you learned something from this video, if you like this video, hit that like button, hit the subscribe button. If you have any questions about National Minority Health Month or anything related to health and wellness in general, you can put those questions in the comment section. If you have any recommendations or requests for future Wonderful Wednesdays, because as you know, I talk about health and wellness all the time on my channel. But if you have a specific request for a topic or condition, you can also put that in the description box below. But again, thank you for sharing this Wonderful Wednesday with me. Be blessed and stay healthy.